Question: what are the common postoperative complications in trauma surgery? Answer: common complications include infection, wound dehiscence, hematoma formation, deep vein thrombosis, and respiratory complications. Question: how can postoperative wound infections be prevented in trauma surgery patients? Answer: proper aseptic techniques, prophylactic antibiotics, and wound care protocols help prevent postoperative wound infections. Question: what is the significance of postoperative respiratory complications in trauma patients? Answer: respiratory complications, like pneumonia and atelectasis, can lead to increased morbidity and prolonged hospital stays after trauma surgery. Question: how are postoperative deep vein thrombosis, DVT, and pulmonary embolism, PE, prevented in trauma surgery patients? Answer: early ambulation, mechanical prophylaxis, and pharmacological prophylaxis reduce the risk of DVT and PE. Question: what is the role of early mobilization in preventing postoperative complications after trauma surgery? Answer: early mobilization helps prevent complications like pneumonia, deep vein thrombosis, and pressure ulcers by improving lung function and circulation. Question: how are postoperative pain and discomfort managed in trauma surgery patients? Answer: multimodal pain management approaches involving analgesics, nerve blocks, and physical therapy help manage postoperative pain. Question: what is the significance of postoperative delirium in trauma surgery patients? Answer: postoperative delirium can lead to cognitive decline, increased morbidity, and longer hospital stays in trauma surgery patients, particularly in the elderly. Question: how can the risk of postoperative urinary retention be managed in trauma surgery patients? Answer: proper fluid management, timely catheter removal, and bladder assessment help manage the risk of postoperative urinary retention. Question: what is the role of nutritional support in postoperative trauma patients? Answer: adequate nutrition supports wound healing, immune function, and overall recovery in postoperative trauma patients. Question: how are postoperative wound complications managed in trauma surgery patients? Answer: timely wound assessment, appropriate wound care, and potential surgical debridement help manage postoperative wound complications. Question: what is the significance of postoperative ileus in trauma surgery patients? Answer: postoperative ileus can lead to delayed recovery and complications. Early ambulation and management strategies help prevent and manage it. Question: how can the risk of postoperative thrombocytopenia be managed in trauma surgery patients? Answer: monitoring platelet levels, addressing underlying causes, and providing appropriate management help manage the risk of postoperative thrombocytopenia. Question: what is the role of early enteral feeding in postoperative trauma patients? Answer: early enteral feeding supports gut function, reduces infection risk, and promotes healing in postoperative trauma patients. Question: how are postoperative anemia and blood loss managed in trauma surgery patients? Answer: blood transfusions, iron supplementation, and hemostatic interventions help manage postoperative anemia and blood loss. Question: what is the significance of postoperative cognitive dysfunction in trauma surgery patients? Answer: postoperative cognitive dysfunction can lead to memory deficits and impaired cognitive function. Preventive measures include proper pain management and minimizing anesthesia exposure. Question: how can the risk of postoperative wound dehiscence be managed in trauma surgery patients? Answer: proper wound closure techniques, early mobilization, and managing underlying factors help manage the risk of postoperative wound dehiscence. Question: what is the role of postoperative imaging in trauma surgery patients? Answer: postoperative imaging, such as X-rays and CT scans, helps assess surgical outcomes, identify complications, and guide further management. Question: how can the risk of postoperative hypothermia be managed in trauma surgery patients? Answer: maintaining appropriate ambient temperature, using warming devices, and preoperative warming measures help manage the risk of postoperative hypothermia. Question: what is the significance of postoperative renal dysfunction in trauma surgery patients? Answer: postoperative renal dysfunction can lead to electrolyte imbalances and require close monitoring and appropriate interventions to prevent further complications. Question: how are postoperative psychological issues addressed in trauma surgery patients? Answer: addressing psychological issues includes providing emotional support, involving mental health professionals, and addressing anxiety or depression. Question: what is the role of postoperative physical therapy in trauma surgery patients? Answer: postoperative physical therapy helps restore mobility, strength, and function, promoting optimal recovery in trauma surgery patients. Question: how can the risk of postoperative cardiovascular complications be managed in trauma surgery patients? Answer: monitoring cardiovascular status, optimizing fluid management, and addressing cardiac conditions help manage the risk of postoperative cardiovascular complications. Question: what is the significance of postoperative fluid balance in trauma surgery patients? Answer: maintaining proper fluid balance is crucial to prevent complications like dehydration, electrolyte imbalances, and impaired wound healing. Question: how can the risk of postoperative nausea and vomiting, PONV, be managed in trauma surgery patients? Answer: prophylactic antiemetics, proper pain management, and minimizing anesthetic agents that trigger PONV help manage the risk of postoperative nausea and vomiting. Question: what is the role of postoperative nutritional assessment in trauma surgery patients? Answer: nutritional assessment helps identify malnutrition risk, guiding nutritional interventions to support recovery and wound healing. Question: how can the risk of postoperative urinary tract infections, UTIs, be managed in trauma surgery patients? Answer: proper catheter care, early removal of catheters, and maintaining proper hygiene help manage the risk of postoperative UTIs. Question: what is the significance of postoperative thrombosis in trauma surgery patients? Answer: postoperative thrombosis, including deep vein thrombosis and pulmonary embolism, can lead to life-threatening complications and requires prophylactic measures. Question: how can the risk of postoperative sepsis be managed in trauma surgery patients? Answer: early identification and management of infections, proper wound care, and appropriate antibiotic therapy help manage the risk of postoperative sepsis. Question: what is the role of postoperative nutritional support in trauma patients with open wounds? Answer: nutritional support, including adequate protein intake, vitamins, and minerals, supports wound healing and prevents complications in trauma patients with open wounds. Question: how are postoperative cognitive issues managed in trauma surgery patients? Answer: addressing postoperative cognitive issues involves managing pain, minimizing anesthesia exposure, and providing cognitive rehabilitation if needed. Question: what is the significance of postoperative bowel dysfunction in trauma surgery patients? Answer: postoperative bowel dysfunction can lead to ileus or constipation. Early ambulation, proper hydration, and bowel management strategies help manage this complication. Question: how can the risk of postoperative respiratory infections be managed in trauma surgery patients? Answer: early mobilization, incentive spirometry, and proper respiratory hygiene help manage the risk of postoperative respiratory infections. Question: what is the role of postoperative rehabilitation in trauma surgery patients? Answer: postoperative rehabilitation, including physical therapy and occupational therapy, aims to restore functional independence and improve quality of life. Question: how can the risk of postoperative anastomotic leak be managed in trauma surgery patients? Answer: proper surgical technique, adequate blood supply to the anastomosis, and careful postoperative monitoring help manage the risk of postoperative anastomotic leak. Question: what is the significance of postoperative wound care in trauma surgery patients? Answer: proper wound care, including infection prevention, dressing changes, and monitoring for signs of wound complications, is crucial for successful recovery. Question: How can the risk of postoperative venous thromboembolism be managed in trauma surgery patients? Answer: early ambulation, mechanical prophylaxis, and pharmacological prophylaxis help manage the risk of postoperative venous thromboembolism. Question: what is the role of psychological support in managing postoperative trauma patients? Answer: psychological support helps patients cope with the emotional challenges of recovery, reduce stress, and promote overall well-being. Question: how can the risk of postoperative wound dehiscence be managed in trauma surgery patients? Answer: proper wound closure techniques, adequate nutritional support, and monitoring for signs of wound complications help manage the risk of wound dehiscence. Question: what is the significance of postoperative renal dysfunction in trauma surgery patients? Answer: postoperative renal dysfunction can lead to electrolyte imbalances, fluid overload, and prolonged hospital stays. Close monitoring and appropriate management are essential. Question: how can the risk of postoperative pneumonia be managed in trauma surgery patients? Answer: proper respiratory hygiene, early mobilization, and minimizing risk factors like smoking help manage the risk of postoperative pneumonia.